Hi, I'm Dr. Janae Brown.
And I'm Dr. Nicole Palermo.
And we are two physical therapists at Physical Therapy San Pedro. Today we want to talk to you about why words matter. Because they do, right?
Yeah.
They matter. We chose to talk with you guys about this particular subject because we know that words impact significantly our outcomes. And so when we say the right things and we tell people the right things, it can be very powerful in how things come out, the outcome of things. So Dr. P, like I said, we're really intentional with this in our practice. Talk to me about why you think that words matter so much. Why are words so important? And as a clinician, in your experience, how have words impacted, how you have dealt with your patients or experiences with your patients?
Yeah, I love this topic because I feel like our most challenging patients are the ones that come in that have heard these negative words in their lives from different people, and they need the most encouragement.
Yeah.
The most difficult patients come in feeling like they're broken, they're hopeless, that they can't, their body's not going to heal, that they're never going to get back to sport. And those are oftentimes the most challenging patients to work with because we have to constantly try to tweak their mindset.
Yeah.
And change how they feel about themselves.
Yeah.
Also, words really just create a culture, they create a mindset, they develop that patient's perspective in life.
Yeah.
So if they have this negative perspective on everything and what they do, then that negative is going to roll with them through everything that they do.
Sure. For sure.
So it's really important to talk about words and why they matter. And Dr. Brown and I we really make it our life's work to help change some negative words into more positive so that we can grow from there.
For sure. Yeah. And we know how much, like you said, mindset matters. And, we know, like, if you look in the mirror and you say to yourself, like, my nose is big or whatever, and then someone tells you, like, that your nose is big, like, then you're just going to walk in that. Like, you're going to believe that maybe your nose is, I won't say big, but bigger, but that doesn't mean it's a negative thing. Yeah, like something that, beautiful big noses are beautiful, right? So I think we receive a word and we take it as a negative thing because when it's said to us, it makes us feel a way, and that creates a mindset for us. And we just need to be careful to not walk into things that we hear or we're told, because we're told things like this all the time. Yeah. So Dr. B, what are some common words? What are some common statements that we hear from our patients that we just wish that we could just say no?
Yeah.
Stop saying that.
Yeah.
Yeah.
Well, other than like demonizing certain exercises, I want to just give you guys a list of words or phrases that we hear patients say, and then try to just flip it to a positive or less harmful thing.
Yeah.
I just thought of a really good one that I always change.
Okay.
So let's say someone comes in with a bone spur. Their MRI said, I have a bone spur. So that patient's like, oh man, I got a spur. I'm screwed. I need surgery. I can't walk on this thing ever again. But they've had the spur growing in them for years.
Possibly, yeah.
I try to say, how about a spur seems very scary.
Yeah.
Let's call it calcification.
Okay.
So you don't have a spur, it's just calcification.
Yeah.
And then I said, does that sound less scary to you?
Yeah.
They're like, yeah.
Yeah. Yeah.
So we just try to flip it so it's not so like detrimental to their life.
Absolutely.
And you can live with calcification.
Yeah.
Absolutely. And
yeah.
Oftentimes you can make it go less and less painful, less inflamed, but that's on our side of the story.
For sure. What about squatting? Squatting, I'm sure you guys have been told or heard squatting's bad for your knees. What if someone's told that? What would you do if your patient told you, like, well, my doctor told me that squatting's really bad for my knees, so I can't squat? Besides, like,
yeah. Well, I give them the example. Well, how do you pick up anything off the ground? How do you get off the toilet?
Magically. It eliminates.
I know. How do you get, under your bed to reach for something?
Yeah.
We squat.
Yep.
So those fearful words of squatting is bad for your knees, we got to get rid of those.
Yep.
the flip side, what I try to flip people on with the squatting is that, well, maybe you're not flexible or you're not strong enough. That's literally it.
Yeah.
You can squat and you will squat if you work on it.
Yeah.
It's not bad for you.
Yeah, for sure, for sure.
And it's not going to harm you.
What about a slip disc?
Oh,
I have a slip disc.
Or my SI is out.
My SI is out. My hip is out.
Yeah. We just got to cut those words out because I feel like they make us feel weak, or they make patients feel like they're just weak, fragile humans that can just slip out, at the drop of a dime, which some people do. They have like some dislocation, but really our discs are not just these squeezable jelly donuts that flush everywhere. Our bones don't just magically come out of place or in place again. So I try to twist the words and say, no, your back just wasn't prepared for what you lifted that day, or you moved a little too quickly and your back was felt unsafe, so it spasmed on you.
Yeah.
Or your hips just a little rotated right now because you're tight somewhere.
Yeah.
So I try, and that seems a lot less intimidating than, oh, my body's out of place.
Yeah.
Right?
Yeah, for sure.
And you're more in control of that. So those words really, they influence how you will heal.
Yeah.
And if you feel like you're hopeless and that your body's weak and fragile, it's going to destroy your whole rehab potential.
Yeah. What you have any other ones you're in chat on? My one that bothers me is that you can't like lift anything heavy from the ground. We've had patients come up to us or come to our practice very often and say, well, I have a bad back and my doctor told me I can't lift heavy things from the ground. And then I say, well, you have a good back because you have a back. God gave you a back. Yay for that. You have a spine. And we probably need to get a little stronger. And one of the ways we got to get it stronger is we got to lift heavy stuff from the ground. So I'm just going to take everything that was said and change it. And, I think that, that is a common thing that we sometimes see because we see practitioners, we see clinicians, we see physicians and doctors of anybody. It could be a nutritionist, it could be a non-clinical person, but we hear these statements like this and they get repeated and repeated. And people say things like this. People say things like, maybe you shouldn't lift from the ground or you have a bad back. Often because as a practitioner or a clinician, it's based on their experiences.
Their one experience with somebody that.
Yeah, or fears, right? They might be scared because maybe that one patient that they had that lifted something heavy from the ground that had a disc herniation prior to that, was never able to lift again or really hurt themselves after that and was, had a lot of pain after that. And that one experience or maybe a couple impacts what they say. And it's just not right and it's not fair because it's not true about people. We can't make blanket statements like that. It's just, we just can't do it. We can't say you will never, you can never, you can't, you will never be able to. It's just, we see that the body is resilient. There's sometimes when we have to adjust, but it's not a never, it's not a one all be all thing, right? So Dr. P and I have some things we want to share with you. We want to clear up some statements. We're going to give you some statements that we want to replace a negative with a positive for you. So when, what's a statement for, if you're not broken, right? So give me some statements, Dr. P, that you like to tell people when they say to you things. Let's do some good and bad with it. So with a you're not broken, what would you say?
So you're not broken can be replaced with you're just healing right now.
Yeah.
Okay. But you are not weak. You are just healing at this time. Right? Painful muscles don't want to contract. So you're not weak. Your body is resilient. Yeah. And it will bounce back.
Yeah.
That's a good one.
Yeah.
Okay.
That's another one.
Let's see. The no pain, no gain.
Yeah.
I'm gonna hit on this one.
Yeah. Yeah. No pain, no gain is like not a thing anymore. Like,
no. That's probably I hear that all the time from patients.
No pain, no gain.
Right? No,
actually,
that's probably the mindset that got you here.
Yeah.
Right.
Right.
If your body is telling you, you're in pain, then you need to listen to it.
Yeah. Yeah. So it's, yeah, listen to those things. It's just not, you can't function like that.
It's not no pain, no gain.
Yeah,
It's
for
listen to your body and progress
Yeah.
as tolerated.
Yeah.
And
Yeah.
that's what we preach.
Yeah.
And it's definitely not a no pain, no gain, or you can't do anything at all.
Yeah,
You
absolutely.
gotta find that middle,
Yeah.
lovely ground.
Yeah. What about you can be sad and mad, angry? Like some patients think like, I can't be mad about this, or I can't be sad, or I can't feel like I shouldn't feel this way. I mean, what about that?
Yeah. You have to allow your body to go through what it's going through.
Yeah.
I mean, 2020, right?
Yeah.
You have to be okay with where you're at. If you want to cry, you gotta punch something because you're mad that you can't play in your sport, then don't punch anybody.
Yeah.
But, let your emotions go, because your body will hold emotions.
Yeah.
And then it'll stick with you, right? You're angry because you tripped and fell, and then so maybe you're gonna not do that thing again, or you're gonna avoid and go somewhere else. You just let yourself have the emotions, pass through it, and let your body recover.
Yeah, it's okay for us to feel things, to be upset. It's okay to feel that way, to be angry, to whatever things. We can't control everything, but how we move through it is important. We need to be able to cope and move through it in a positive way, and that's going to impact your outcome. So yes, is there anything else we want to say on there? I think we got through all those things. Yeah. So what's the moral of the story? I mean, if we want to leave our followers, our audience with anything, what would you say? What is something we just really want them to take away from this?
Just listen to people's words carefully and don't trust everything you hear right away.
Yeah.
Okay.
Yeah. And I think also if you are dealing with a practitioner or healthcare provider or trainer, or anybody who is putting, who's putting negative thoughts in your mind, or is not encouraging you and is not uplifting you, you need to run, and you need to find somebody who will, because much of how we do is about what we say and what we're told. And if someone is inputting negative on us or telling us those things, we're likely not to have good outcomes. So it's important to be surrounded by people who are giving you, strong, encouraging words to help you grow and help you get better. Yeah. And we see that, we start there. When a patient comes in our office, we start with our words. They walk in the door and we sit down with them, and they come from a lot of different places. And so we're starting with, where they're at right now, and we're trying to encourage them with our words. We start with our words, and then we move to what we do, physically with them. Yeah. Okay. So, we're going to wrap on that. Where can everybody follow us? So talk to me about where do people find out what we do?
Yeah. So first, you can read our blog, Words Matter, on our website, physicaltherapysanpedro.com.
Yes.
Always on Instagram. Yep. We're always putting our daily exercises and things that we do in clinic. So if you want to see what we do, go on to our Instagram, Facebook, and YouTube, and all of the Yelp and Google. Oh yeah, please read
reviews. Give reviews. Mm-hmm. Yep. And we're doing some cool things. Dr. P has a new IG account, so go follow that. Dr. Nicole Palermo, DPT. Yeah. So go follow that. You can follow her page and find that. She's putting up really great motivation and exercise and all things Dr. P. We are continuing to develop our online programming, so stay tuned for that. We'll be putting clips in.
And we're still doing telehealth.
Yes.
So if you're not in the area, or you would rather stay home and do a session, we're still offering that. So please take advantage if you want.
Yep. And shout out to our new PT we hired, Dr. Miley. She'll be coming on as well. So in addition, it's a girl gang. That's what we do here. So we'll leave you with that. We hope we were able to touch you, impact you in some positive way today. And you guys have a wonderful day. Thank you for tuning in. Bye.
Take care. Bye.